Well, hello, Paul Boehnke, certified life coach here. And as I mentioned in some previous interviews, taking care of ourselves and living the fullest life possible is not easy in our complicated world. So, having a team of people to really help us on that journey is an important thing. A couple of months ago, I introduced you to a friend and a colleague of mine who also happens to be on my own team of healthcare practitioners. Dr. Jacob Panka is a naturopathic doctor, and I've invited him back here to talk a little more with me about what it is that he does. So, welcome, Jacob.
Thanks, Paul. It's great to be back.
Now, in our last conversation, we discussed how, well, one of the principles of naturopathic medicine is disease prevention. How do you really kind of emphasize this in your practice?
This is a great question, Paul, and I'm glad we have the time to discuss it today. Um, Emphasizing disease prevention is a core tenet of naturopathic medicine, and it's based in a holistic evaluation of each of my patients. Everybody's different. There's no one formula that I can apply directly to each person. It starts with that initial evaluation, and then we pay special attention to risk factors for disease. So things like high blood pressure or high cholesterol are things that would stick out, but also more fundamental issues like what we call reestablishing the determinants of health. Things like sleep. Sleep is a very common one for my patients, and that's something that can affect your cardiovascular system, for example, as well. If you're not sleeping particularly well through the night, or maybe you have some sleep apnea, there's natural ways that we can focus in on that to then prevent the development of heart disease, for example.
Yeah, great. So, actually, I'd like to ask you a little more about heart disease and about how you sort of evaluate the risk factors and also the idea of high cholesterol and how that sort of plays into your practice.
Yeah, that's a good focus. I really have had a lot of success treating folks for high cholesterol, and the evaluation is I think a strength of what naturopathic medicine can offer. It complements the standard model very well, what your primary care might offer you. Um, but we have that emphasis on natural approaches to health. So it starts in the medical history, thorough evaluation of your diet, discussing exercise practices, and other lifestyle factors, um, like smoking, for example, that would affect, how risky it is to have high cholesterol. Some things kind of make that cholesterol stickier, so we can get a better idea through the diet, through that entire history of what those factors are that we need to key in on. We really try to be comprehensive and find those factors that are unique to you. Where do you have the most opportunity to make progress? And then the evaluation continues with the physical exam. Do vitals, make sure the blood pressure's in check, just basic things that your primary care doctor would do. We're looking at some of those things as well, but oftentimes we have more time to give attention to detail and go a little further, a little deeper in our evaluation, because we have the time for it. And that's an advantage. We do listen to your heart and lungs. And one cool thing I like to do for folks with concerns of heart disease, concerns of high cholesterol, is to do an eye exam. I can look in the back of your eye and I can tell if that artery, or if the tiny arteries in your eyes are narrowing. And that tells me, how the health of those arteries in those tiny capillaries and blood vessels might be in your kidneys, which is a big issue to consider with heart disease as well. So it's cool how we have that window in, and we can tell kind of on a, look at something concrete and see, oh, we're seeing some progression of heart disease, and we really need to tackle the cholesterol now. in the end, we will be checking lipids, like the primary care doctor, but like has been a theme, we just tend to go a little deeper. So there are some specific lipids, like smaller fractions or specific lipoproteins that are associated with more risk than others. And a standard lipid panel doesn't cover that. So we can, that's something we can add on, as well as some, other cardio tests. It's a huge field. There's so much to consider. And I'm really passionate about working with folks with heart disease. Not only because of the obvious benefits of preventing heart disease, a leading killer in the country. It's morbid, but that is something that folks struggle with. So I'm just happy that I can offer that, and it complements one of my other passions, which is cognitive health, brain health. Cardiovascular disease underlies that big time. So I'm just really passionate about this work, and I'm glad we can talk about it today.
That's great. Thank you. It sounds like you've got so many different tools at your disposal for figuring out what's really going on in someone's life. And I know actually one of the things that you and I have worked on together is my high cholesterol. And of course, when I first learned about this, statins were sort of the thing that the doctor wanted to put me on. And of course, these are the medications used most often to reduce cholesterol. But also know that it comes with plenty of its own side effects. And I know some people who simply cannot tolerate them. And so I'm wondering about how possible it is to lower cholesterol without using these statin drugs. And if so, how do you do that?
It absolutely is possible. And this is a common frustration for folks with their primary care, is that is the end of the treatment, usually, or the end of the evaluation pretty much always lands on, well, we want to recommend a moderate or high intensity statin for you, because they pretty much have zero tolerance. If your cholesterol is over 200, they're recommending a statin. So there's little wiggle room for bringing in those natural approaches first, really trying a comprehensive program of, depending on how high the cholesterol is, various diets can be more or less effective for reducing cholesterol. But then there's also specific vitamins and even botanicals or other dietary supplements that are statin-like, if it comes to that. But it's lower intensity. There are less side effects. And one thing a lot of people aren't familiar with is that you can actually over-medicate on statins. It's common. I see folks come in and their cholesterol is actually too low. And I'm talking to them to go back to their primary care doctor to reduce those dosages, through work that we're doing. And also, just out of the gate, it's like, oh, wow, your cholesterol's controlled, but it's actually too far. And that poses risks to brain health, cognitive health, like I discussed before. There's so much we can do. And I've had a ton of success just with higher doses of specific vitamins, along with diet, lifestyle, emphasizing exercise, working on more high intensity exercise to really get the blood flowing. Some of these things, just your primary care doctor isn't trained in a lot of these natural approaches. They're really good at what they do, but I think naturopathic medicine has a huge role in heart disease.
Yeah, thank you. And I have to say that one of the reasons I actually sought you out first for my own care was high cholesterol. My numbers were, well over 200. And I have to say, using a statin was not what I was wanting to do. I knew maybe that was going to have to be something down the road, but I wanted to see what was possible before we went down that road. And that's when you and I started working together. And I have to say, the supplements and the ways that you have worked with me has resulted in a drop of over 50 points in my own cholesterol, which is a huge relief to me. And I'm very glad to that has happened. But I'm also curious. So you work with people with the cholesterol and it gets lower. What does sort of the follow-up look like for people who are really trying to keep that cholesterol under control?
Yeah, with cholesterol, we're following up pretty much at minimum every 3 months. We're checking in, and that is generally more frequent than your primary care doctor would manage it. That's kind of a really aggressive approach for cholesterol, but I find that we get results and we see it in 3 months, and we need to be making adjustments to make sure we're hitting that ideal level of cholesterol. If things were maybe worse off and we were trying a more aggressive approach, a monthly check-in or some check-in between that first 3 months is common to maybe review labs, make sure the protocol that we've started isn't kind of disturbing other lab values. It depends on the individual, and that's really always the case. But that 3-month period is common for folks.
Yeah, great. Hey, Jacob, thank you so much for joining me here again today to sort of talk about your work. And if people are wanting to learn more about you and your work and maybe how you could help them with their cholesterol, what's the best way for them to get a hold of you?
Please give us a call. Find us on Google. Look for us at pankanaturalhealth.com. And give us a call, 612-568-8382. And more than likely, you get me on the phone and we can get right into chatting.
Great. Thank you again, Jacob. It's been a pleasure learning from you once again.
Thanks, Paul.